The Fellowship of the Great Physician welcomes you to House Call. Our hosts today are doctors of chiropractic, Dr. Gerald Lala and Dr. Richard Jensen, who is also a board-certified acupuncturist, practice independently in North Oaks, Minnesota. Let's join our hosts for today's program that will assist you in your quest for optimum health and well-being.
Welcome to House Call. I'm Dr. Gerald Lala.
I'm Dr. David Sweetert.
And I'm Dr. Richard Jensen.
Wonderful to have you with us again today. We're doing the second part of a three-part series on enjoying strong bones. And very, very important, a major problem today with people having not only osteoporosis, but osteopenia, arthritis, and all kinds of other bone health-related issues. And so we're going to begin with Dr. Jensen discussing and defining the difference between osteoporosis and osteopenia. Dr. Jensen, please.
Thank you, Dr. Lala. Well, osteopenia is the early stages or precursor to osteoporosis, where it is the demineralization of the bone, but it's not yet reached the stage of osteoporosis, where the bones actually become porous and weakened. And if we look at the model to the side here, we can see on the top one here, where the arrow is, we can see that the outside of this vertebral body here is much thicker across here, and the inside, the trabecular structure, is quite dense. So this gives you quite a bit of structural support for the body of the vertebrae. Now we have to realize that a great deal of the weight that comes down the vertebral column comes right through this area. So this is the area that we're the most concerned with when it comes to structural support. And what happens with osteopenia is that we have a thinning of this bone that's around the center here. It's a demineralization of the bone, and then on the inside here there's much less density within there, so we can see that there's a weakening of the bone. And then the third and last stage here is we're finally into the disease called osteoporosis, and where you see there's a real thinning along the cortical structure of the bone here. That's the outside area, in which you see where it has this bend down in here. This bend, as opposed to the top one where it's straight, that bending is caused by that there's so much weakening down here. You have microfractures that are causing the weight to bend it in on both sides here, and you have much less support on the inside due to that demineralization of the bone. Another model that we can look at from that regard is with the sponge. This is a sponge, but if you look at it, you have a great deal of density within that sponge. But then if we're losing that density, it becomes porous. I guess we're going on to the corticosteroids there. If you look at that slide again with corticosteroids, these steroids here, it falls from cholesterol and pregnenolone to progesterone. And then progesterone takes us down two sides, where we're looking at, on the right-hand side, there's cortisol and cortisone. And if we have too much stress that's going on, a heightened amount of stress, see, the body works with stress by releasing the hormone cortisol and cortisone. And if you look at it, we're not meant to deal with stress on a continuous basis, on a basis that it just goes on and on and on and on. We're meant to have short snippets of stress, whereas in the old days, man meets lion. Man either runs from lion or fights lion, and either this man overcomes and therefore the stress is gone, or the lion overcomes and therefore the stress is gone as well. Much different outcomes, but the stress is only there for a period of time. Now, the reason for this is that if we have cortisol that remains in our body for a long period of time, it can actually tend to start breaking down the bone and causing this disease process of osteoporosis and osteopenia. So, Dr. Sweetert, do you have some further ideas on this?
Thank you, Dr. Jensen. Of course, one of the things we want to look at is, have you had or are you currently being treated for any of the following illnesses or disease processes? Asthma, arthritis, and of course there's various forms of arthritis. Cancers, isn't that interesting? Cancers. Crohn's disease. Cushing's syndrome or Cushing's disease. Diabetes and irritable bowel syndrome. These are some of the important disease processes that have an effect on calcium metabolism and calcium utilization within the body. Also, looking at hyperparathyroidism. Are the parathyroids putting out too much parathormone, affecting the calcium absorption and utilization within the body? Lactose intolerance. You know, interestingly enough, by about age 7, in the Western society that we live in, the body is producing less and less lactase, that enzyme that breaks down milk sugars and milk products. And of course, interestingly enough, if we don't have the enzymes to break down the product, lactose or milk products are going to cause us a lot of problems. And I think that we see that in the pyramid or the triangle or whatever the government has got going here, you know, there's heavy emphasis on milk and dairy products. That'd be cheese and yogurt and ice cream and various things that they're added to. Well, if you don't have an adequate amount of lactase or you are milk intolerant, you're not going to be able to get your calcium adequately and in a bioavailable form from milk products. So, interestingly enough, there are a lot of other ways to get calcium within the body. Now, one of the biggest problems that we see in Western society that we live in is that with the soda pop and high phosphorus content drinks that people, both kids and adults, drink, it throws off this calcium phosphorus ratio. And when you have an imbalanced calcium phosphorus ratio, you are not going to absorb calcium, or you're going to lock it up so it can't be absorbed. Also, we know that caffeine, high amounts of caffeine in the diet can affect calcium absorption and utilization within the body. Another form of disease process that we'd look at would be osteomalacia or Paget's disease, another disease process that affects bone. Renal dialysis and transplant. We know that the minerals are imbalanced in dialyzed patients. And of course, they're looking at those electrolytes every time that they go in and dialyze them, but it really creates havoc within the human body. And of course, then rheumatoid arthritis, another form of arthritis that is very important in the metabolism and utilization of calcium. Now, Dr. Lala is going to take us on to the next slide.
Thank you. What we've been doing in part 1, 2, and 3 here is we're going through a questionnaire that we have all of our patients fill out with reference to osteoporosis. And if your physician is not having you fill one of those out on a yearly basis, we'd encourage you to ask he or she to provide one. If you want a questionnaire like this on your own, you're more than happy to call us. They'll be bringing up our telephone number, because it doesn't look like we're going to get through all of this material. So some of the other predisposing questions or factors: have you had or are you currently being treated for any of the following illnesses? Lupus, spastic colon, spinal stenosis, seizures, thyroid disease, ulcerative colitis, and spinal problems. Now, Dr. Jensen is going to ask you the next question now.
Okay, well, have you had any of the following surgical procedures? Have you had any stomach surgery or gastric surgery? This can affect your digestion in a great deal, and therefore the absorption of the minerals such as calcium. A hip replacement surgery, which would represent many times that you already have some calcium problems. Large bowel or colon resection, We're looking at our digestion again. Mastectomy or lumpectomy can also be indicative of some causes of osteoporosis. Renal or kidney transplant, which Dr. Sweetert had covered about how it balances the electrolytes in our body, of which calcium is a major electrolyte within our body. Now for the next slide, Dr. David Sweetert.
As we continue on, we're looking at a small bowel resection, where some of people are going in to have a weight loss, and so they're going to go in and cut out or put loops or tie off certain parts of the intestines so the food isn't absorbed. When that happens, of course, you're going to have problems with absorption of a lot of different things, but especially your minerals. Spinal fusion would be another one. Spinal nerve block, thyroid surgery, parathyroid surgery, and radiation therapy. All these can be predisposing factors. Dr. Lala?
Thank you. Have you taken or are you presently taking any of the following medications? Steroids, dilantin, diuretics, fluoride, heparin, methotrexate, synthroid, or tamoxifen? Dr. Jensen?
Thank you, Dr. Lala. Do you eat dairy products on a regular basis? Dr. Sweetert?
Do you exercise on a regular basis? And if you do, what types of exercise is it? Is it aerobic, anaerobic? Is it weight-bearing or non-weight-bearing? Important questions to know. Dr. Lala.
And as Dr. Sweetert said there, the importance of walking, and he mentioned also there's two forms of exercise, aerobic and anaerobic. And when you should know your aerobic efficiency rate, your pulse rate. If you don't have a chart on that, we're happy to send you one. Dr. Jensen now has the next question.
Are you exposed to tobacco smoke? Do you presently smoke? Have you smoked tobacco products in the past? Or are you exposed to passive smoke? These can also have effects on your absorption and utilization of these minerals. Dr. Sweetert.
Are you currently taking estrogen, such as Premarin, Ogen, estrase, or other forms of estrogen byproducts, or the patch? How many milligrams a day are you taking into your body? For how long have you taken it? Is it months or years or decades? Do you take estrogen, such as Provera, Premarin, or Prempro? And if you do take these, how long have you been taking them? Dr. Lala.
What we're going to do is bring up a pamphlet here that you could call and request a natural solution to fatigue and female hormone-related problems, as well as this questionnaire that we're going through. We're really looking at factors that are really predisposing factors to osteopenia or osteoporosis. Is osteoporosis or osteopenia preventable? It certainly is. If you or a person has osteopenia, been diagnosed with osteopenia or osteoporosis, is that it? Is life over? Are you going to continue to get worse and worse? No. If you find out what your hormone levels are, find out what your calcium and other electrolyte levels are through blood testing, for example, and then get on the proper type of calcium, and there are many different types of calcium, and some are very poorly absorbed, and others are much better absorbed. And if you find out what the right type of calciums are, and you begin to take those based on what your blood study tells us you need, then you completely stop this osteoporosis, and you have the high probability of reversing it. And so you don't have to live with osteopenia or osteoporosis. You don't have to come down with osteoporosis. You don't have to have your osteopenia turn into osteoporosis if it's handled correctly. So now we're going to go to the next slide, and that's with Dr. Jensen, and he's going to take a look exactly what I mentioned here a few seconds ago, hormone analysis, the importance of hormone analysis, and what should be included in a proper comprehensive hormone analysis. Dr. Jensen?
Thank you, Dr. Lala. Well, we find, and it's interesting, that the liver processes, and it can manufacture a lot of these hormones as well, but the liver also creates about 80% of our cholesterol, which is the basis of which all the hormones are created. in our body, at least from this perspective here, not the neurotransmitters, but the main steroidal hormones are created here in with cholesterol. And so cholesterol is very important. Many days, many times, we had this kick a decade or so ago to really lower your cholesterol and go as low as you can go. And many people started to achieve this. And what they found was that these people with ultra low levels of cholesterol, thinking it was very healthy for heart healthy, that it actually spun them into depression, clinical depression. And that's due to a lot of these hormones not being created. And so if we go back to that slide now, with the basis of the cholesterol, it's the precursor to pregnenolone, and pregnenolone to 17-hydroxy pregnenolone. And then the DHEA, and DHEA is actually the hormone that we have the highest content of in our body. And the reason, if you look at all those hormones that are created from that as well, with ethyl-calanolone and androsterone, and then you're seeing testosterone and the estrogen family also being created from DHEA. Many people looked at this. It came out with information years ago that DHEA was the thing that you needed to take for postmenopausal women. It was almost like a fountain of youth for them, because all these sex hormones that we use in our days of vitality came after that, and so they were lifting that up. And what we found is people who self-ministered DHEA many times when we did a test like this, they just had way too much. That usually products that are out there in the markets had 10 times the amount of DHEA that these people should be taking for even therapeutic uses. And so we had a number of things going wrong with a huge bone exchange and things like that going, that would be deleterious to someone just taking it for those purposes, because they were messing everything else up. And so when we go back to this chart with testosterone and androstenedione, if you see the arrows go back and forth, those two will actually, depending on the content that you need in your body, they will be turned back and forth into each other. It's a more of a dynamic thing. Same thing with the estrogen family, where we have estrone and estriol and estradiol. Estrone and estradiol goes back and forth as to what the body needs as well. So as we go...
one thing I'd like to add, as long as we leave that chart up there again, let's remember now, all hormones are manufactured from cholesterol. It is a sterol in itself, if you look at the spelling of the word. And what Dr. Jensen has been doing there is showing you the metabolic pathway, how these hormones are manufactured. And a major intersection there is the DHEA, and if there is any natural hormone that is misused in society today by women, it is this DHEA. And the reason it's because they're going into these health food stores or into some health practitioner's office who's pushing it, and without any previous comprehensive scientific analysis of their hormones, they're taking this DHEA. And it is, even though it's not a great analogy, it would be just as foolish to be taking natural hormones, be it a female or a male, just as foolish if you were to take penicillin or streptomycin without first having a blood test to determine what your white blood cells are, or a blood culture to see if it is a staph or a strep infection. And that's one of the major problems in the natural health industry and the alternative health industry today, is that even though it's wonderful that it's not highly regulated by the government, the downside of it is that people are going out and treating themselves without proper first diagnostic testing. And when you begin to take these substances into your body, you're going to create problems. And it is no different than these athletes who are caught taking these enhancing hormones. These hormones, such as DHEA, can be very, very dangerous. Right, Dr. Sweeter?
That's absolutely right. And as we look at the big picture, we as a society are doing a disservice to ourselves. And I speak to men and women combined here, if we don't adequately test and know what we're doing to our bodies. I mean, it just doesn't make any sense that we would take drugs or pharmaceutical or food grade products that have pharmaceutical responses within the body and not know if we need the product or not. It doesn't make sense. If you think about it, does it make sense that you would just take something and hope that it's going to relieve this symptom or relieve this condition without testing for it? I use the analogy, it's kind of like going to a dentist and have them just whip out the drill and start drilling on your teeth without an exam or without taking x-rays or without taking history or without doing anything. It's so silly. And as Dr. Lala said, I want to reemphasize, the natural alternative healthcare industry really has done a disservice to people by not at least offering, saying, look, before you take this product, you ought to have these tests done. So now I want to pull up another side of the slide that talks about how these corticosteroids are metabolized and utilized within the body, and let's look at a little bit more of the flow. We know that cholesterol, as Dr. Jensen, Dr. Lala has already said, we know that cholesterol, 80% of it is produced by the human body. That means only about 20% or up to 20% is influenced by the foods that we eat and what we intake. So, not only is cholesterol important for the formation of hormones, but it's also, remember, the liver is very important for the breakdown of the hormones, because remember, after the hormones do their work within the body, when the estrogens through the female cycle are used every month, they got to be metabolized. They got to be broken down by the liver so that they can come back around. And that's really, really important. We're talking about liver health. It does over 480 known functions. I'm sure it does even that many more that we don't even know about. So cholesterol is a precursor, as we said, to pregnenolone, which is a precursor to progesterone. And then progesterone goes and breaks down into two different pathways. On the right side, we can see it goes to 17-hydroxyprogesterone. Then it goes on down to 2-desoxycortisol, and then it goes into cortisol and cortisone. Where have we heard those from before? We had talked earlier about the importance of the adrenal glands, cortisone and cortisol. Cortisol released in high levels of stress. It's a precursor to heart problems. It's a precursor to other types of degenerative processes that can take us out. And cortisone, of course, is an anti-inflammatory hormone. When you go into your doctor, you've got a swollen knee, you've got a swollen elbow. Often the PA and the nurses and the doctors are injecting cortisone within the joint. Why are they doing that? Well, because it's a very powerful anti-inflammatory, and it can reduce inflammation. But one of the side effects of it is that for a temporary purpose and time, it shuts down the body's own ability to produce cortisol. So yes, there is a side benefit, but you've got a negative that can affect it. Now let's go back to the slide and look on the left side. Progesterone, precursor to desoxycorticosterone, again a precursor to corticosterone and the important hormone aldosterone, important in the body for fluid levels, for function, kidney function, and others. So again, these urinary hormones that we're talking about are for men and women important, especially menopausal, premenopausal, postmenopausal. It's important to know if you take out the ovaries or you reduce the function of the ovaries, is there a backup system? Well, yeah, there's a backup system. God designed it. It's called the adrenal cortical system. And with a lot of people that are under a lot of stress today, emotional, physical, spiritual, psychological, biochemical stress, it's going to have an effect on the body. And when that backup system goes down, then things start falling apart in a very serious way. Dr. Lala, what do you think?
I think that we should take a look at the different types of calcium. We've been talking about that, and as you see in the screen now, the most absorbable form of calcium is at the top of your screen, microcrystalline hydroxyapatite. That's not a commercial name. It's sold under a lot of different names. But that's the form of calcium that most resembles the matrix of bone. The second most absorbable form of calcium is calcium citrate. It's not as absorbable, it's not as good a form, but it is pretty good. Calcium orotate is another form of calcium, not as absorbable. Calcium lactate, not as absorbable as microcrystalline hydroxyapatite. Calcium gluconate, that's partly made from molasses, so people who have diabetes or hypoglycemia, people who are on low carbohydrate diets should not be messing around or taking calcium that comes from calcium lactate or calcium gluconate. Now there we see the next one, calcium carbonate. It is the most common form of calcium sold in the world today. The source of calcium is calcium carbonate, and look how it is a very poorly absorbed form of calcium.
And cheap.
It's not, and the reason they do it is because it's so cheap. So the cheaper, the less expense that they have to put into manufacturing the product, the higher the potential of product. Now bone meal is taken from old cows, and what you're doing there is it is not a readily absorbable form of calcium. It's coming from an animal, not a human, and that bone meal contains all of the things, the nutrients that those cows have eaten, including contaminants that have been in the feed and the grasses that they've eaten. Dolomite, you might as well go out and almost chew on a piece of concrete. It is the hardest form of calcium. It is very, very difficult to absorb. So the most absorbable form of calcium is microcrystalline hydroxyapatite. The least absorbable forms are bone meal and dolomite, and that's why when we do blood studies on people and we check their electrolytes or their minerals, and here they're taking 1,000 to 1,500 to 1,800 milligrams of calcium a day, and they still, when we have x-rays of them, we make x-rays of their spine and pelvis, we see what? Osteoporosis, they shouldn't have it. When we check their electrolytes or those minerals in the blood, guess what? They're low on calcium, and here they're taking adequate amounts of calcium. We check their hormones. Many times the hormones are normal, and they're into weight-bearing exercises, and still their minerals are low, and they still have osteoporosis and osteopenia. Why? Generally because they're doing everything they think they should be doing, but the fact is they're taking a form of calcium that is not readily absorbable. It does not resemble the matrix of bone. And I'll tell you what's happening to most of that calcium that they're taking. It's being excreted in their feces and their urine. So the fish in the rivers and the lakes are the ones who are profiting, or maybe they're not profiting from it. So again, we're destroyed for a lack of knowledge. Would encourage you to do science-based nutrition. Don't be shotgunning yourself. It's no good for you. It really is not. Not good at all.
The Fellowship of the Great Physician, through its School of Health and Healing, provides classes each Thursday evening. The primary focus of these classes is biblically based spiritual health and healing, with a brief teaching on physical health and healing. There is no charge or registration fee for these classes, but a free will offering is received. For further information on the School of Health and Healing, class time and location, or the topics discussed on today's program, contact us at the Fellowship of the Great Physician in care of Dr. Lala or Dr. Jensen at 200 Village Center Drive, Suite 100, North Oaks, Minnesota, 55127, or telephone us at 651-484-8521. Thank you for joining us today.